This conference will now be recorded.
So I was doing an update with my friend, the dentist and founder of the Wellness Dentistry Network, Doug Thompson. He's been on the channel several times. He reminded me that February is Heart Health Month. I didn't get it because for me every month is Heart Health Month. I'm just sometimes way too deep into it. Another thing he mentioned though, and he'll cover that a little bit later in this discussion, is the issue about oral pathogens. We've all known, and we've all been following the evidence indicating that bacteria in the mouth can cause a significant cause of cardiovascular inflammation. There's some information coming out from a periodontist researcher, I think somewhere in California, Jurgen Slotz, who's underlining the importance of some of the oral pathogens that your doc or your dentist may not pick up because they're viral. Oral herpes being one of the more important ones. I actually got so interested in it, I did a separate video on herpes and cardiovascular inflammation. But I'm getting ahead of us, Doug. Why don't you take us away?
Yeah, thanks for it. One of the things I had to do is try to figure out how to help our WDN members let their patients know that we're interested in heart disease and that we think it matters. So we created these placards that we put up in the office, and the one you see on the left of your screen is called Health Measurables That Matter Cardiovascular Disease, and we're basically letting people know that we want them to know if they have a history of heart disease, if they've ever been tested for any kind of blockage or plaque in their vessels, and then that you can help people discover the difference between their vascular age and their chronological age. And we want to know that for some people. And then we want them to know some basic lipid numbers and some of the basic numbers. So that's a really easy awareness piece. But interestingly, the relationship between heart disease and oral health is really these bacteria. And so as I look at a bacteria test that comes from one of the companies that we use, the testing companies not only measure for the concentration and level of certain bacteria, but it reminds us that these bacteria not only affect cardiovascular disease, but they affect cancer, they affect muscle and joint health, dementia and brain health, metabolic health, and pregnant women as well. But more than just bacteria, when you and I were discussing, it's just now this new piece about viruses. And we have viruses to consider too. And so our treatment modalities are getting to be more expanded, not only to be antimicrobial, but we want to make sure they're antiviral and antifungal as well. And so we also know, and Inger Olsen wrote a really nice paper about oral infections and can they be a risk factor for Alzheimer's disease. So you've helped me learn that, if you're concerned about vascular disease, the vessels feed your brain too. So it's really a big deal. And so and in his paper, he talks about viruses too being part of the vascular degradation process in the brain in the end of Alzheimer's. So there's multiple reasons why people have Alzheimer's and heart disease and these diseases. And the two images on the left are Dale Bredesen's book, where he says, there's 36 issues. I mean, there's hormones, there's lifestyle factors, there's viruses, there's, these other things. And when we get training, 36 holes in the roof. And then when we get trained by Dr. Bale and Dr. Doneen, which you saw the beat the heart attack gene on the first slide, this is a poster from their book that talks about root causes. And it's interesting because they have these big fat roots and these little skinny roots on the tree trunk of inflammation that basically provides the fruit of atherosclerosis. And they use this cartoon imagery to talk about this process. And I found it fascinating that after you and I talked a lot and we looked at these different diseases, that if you just take the Bredesen holes in the roof concept and you flip the Bale Doneen poster upside down, it's the exact same thing. So what it tells
factors, and it's all back to arterial and cardiovascular inflammation.
And one of those big fat roots is insulin resistance and metabolic issues. So I really appreciate you doing that for me. So what you helped me do, Ford, is we put together an inflammatory panel that even dentists can take on their patients to help discover if they have these issues. Now, I want to be clear, dentists can't treat this, but we need you to do that. That's why we're trying to create this collaborative union, and that's why we're speaking so much on these topics. So it's really nice. And so we do have a Wellness Dentistry Network lab panel. So I want to just thank you, Ford, for bringing to the light the idea that there's multiple components to the vascular disease process, and we need to make our patients aware. You're one of our partners in health in our library, so we have you have mechanisms for patients and people that can reach out to you. And I know through your YouTube channel, people, we'd love them to reach out and find a Wellness Dentistry Network member dentist. They can go to wellnessdentistrynetwork.com and they can look in the directory. And we would hope, and what we're trying to do is get these dentists, like you're trying to help physicians, get these dentists to be aware of these things and really help our patients in a number of ways beyond just the teeth.
Thank you very much, Doug. I'd like to comment on one of the things that you said. You said, of course, the dentist can't treat cardiovascular inflammation. And I know you've been beat about the head. You've been pummeled on that issue because you've been a strong voice, and not only a voice, you have been a major enactor, a major facilitator for helping dentists get involved in this area. I know you've gotten criticism from the doctor side saying, what are dentists going to do with this? I'm a doc, so I can be a little bit more verbal about my issues. And I'm also a public health doc too. I've noticed this is a giant public health issue. There's nothing that's killing more people than cardiovascular inflammation. There's nothing disabling more people than strokes and cardiovascular inflammation. We use totally untrained people. We use health coaches. We use health coaches are trained. We use trainers to look for things like blood pressure. So it's like the focus on saying dentists shouldn't be doing this. Admittedly, as you can see, I'm starting a rant on this issue. I got to make one other point about it. Even the statement that you can't treat it, you have to refer it. I understand that. I've heard that many times, and I agree with the perspective on it. But I also have another perspective. If we're talking about oral infections, oral pathogens, periodontitis being major causes of cardiovascular inflammation, the heck that you guys can't treat it. You're very much involved in the treatment of it. So,
well, Ford, that's true. We really are. And really what my big message to dentists is, and what I'm trying to get dentists to do is realize that what we learned in school years ago about how to treat this disease really isn't enough. And many of us don't detect it early enough, and many of us just don't treat it early enough. And so from that aspect, you are absolutely correct. We are helping treat it. We're collaborating. I didn't want to go here, and I don't want to make this little time together longer than necessary. But Ford, this is a simple little thing right here. Look at this on the screen. I look at a Panorex. This is a regular film that I take in my office all the time, and I spot something on the Panorex that doesn't look right, and I send this guy over for carotid scanning, and we find out I got a 28-year-old kid with the arteries of a 51-year-old, and he already has a pretty decent plaque buildup. So that's the kind of thing I think dentists could do. But you can't, and I'm going to back up to where we were. But you can't do that if we don't have that kind of knowledge. So I'm trying to get dentists to learn how to manage periodontal disease, and then I'm loving the time we get to spend together where we can help share with dentists what these other things mean. So it's just been a fantastic journey, and I'm going to continue to be a voice for it because the research and the literature is supporting us more than ever.
Thank you for what you do, Doug, and thank you for your time on the video today.
Thanks, Ford. Talk to you soon.
Okay.